Rashmi Halker Singh. I'm the deputy editor of Headache. I'm joined today by Dr. Pooja Patel, who is the author of a recent publication entitled Headaches and Sjogren Syndrome, a narrative review. Welcome, Dr. Patel. I'm so happy to speak to you about your recent work.
Hi, it's great to be here and nice to meet you as well.
So, first of all, we don't have a lot of literature on this topic, and I'm curious to find out more about why you chose to study it.
Okay, thanks for asking me this question. So, I am interested in headache medicine, and I'm also interested in like a multidisciplinary approach to patients. So, kind of going about this, I was inspired by actually attending the resident education symposium for neuro residents that was hosted at UCLA last year. At this talk, we had many talkers and speakers who mentioned the Headache Journal and really focusing on subspecialties within medicine, kind of approaching different patient populations. I have an interest in rheumatology as well. So, going about this, I had researched different articles on headaches and rheumatology patient population. I found that there were many articles on the most common rheumatological condition, lupus, but not so much regarding other rheumatological conditions. I ended up picking Sjogren since it's the most common, second most common rheumatological condition, and I focused my research on the different types of headaches that are in the current published literature regarding this patient population. So, going about this, we had reviewed the different primary and secondary headaches that are most commonly associated with this patient population.
Awesome. That's true. You are a trainee, so I'm really happy to hear that as one of our American Headache Society programs that inspired your work. That's really great. Great background to that. First of all, tell me about your project. What did you do and what did you find? And were you surprised by any of your findings?
Yep, sure. So thanks for asking me this question. The way that we conducted this project, along with other authors, is that the primary question was to determine if there are any headache disorders, both primary and secondary, that are linked to Sjogren syndrome, and which ones are they, and how are they linked to Sjogren syndrome. So we used PubMed and Google Scholar to screen for different articles with keywords being Sjogren syndrome, headaches, and the various types of primary and secondary headaches, including migraine, tension type headache, as well as nummular, stabbing headache, and secondary headaches, including aseptic meningitis, idiopathic intracranial hypertension, as well as CVST. So these are the main headache disorders that we had investigated that were possibly linked to Sjogren syndrome. Our research project focused on the association between these different types of disorders and Sjogren's, and we found that Sjogren's is linked to these various types of primary and secondary headaches. And we also found that there's not that much literature involving all of these headache disorders. Some of the headache disorders are limited by case reports, while others have more thorough, in-depth studies with a greater patient population. So it's a little varied. But the main thing that we have found is that Sjogren syndrome is linked to neurological complications like headaches, both primary and secondary headaches. And this can help both neurologists and rheumatologists, as well as even internal medicine doctors, family medicine doctors who are taking care of patients with this condition, recognize that these are commonly like reported headache disorders and to identify and then treat them.
Awesome. I think that's really interesting. I'm a headache subspecialist, and I see many, many patients in my clinic. Based on your study, when should I be considering screening a patient for possible Sjogren syndrome? Are there specific things that I should be asking in my history or looking for in my clinical examination?
Yes, that's a good question. So I know we're not rheumatologists, but we can screen for Sjogren syndrome. And the three main cardinal symptoms that patients with Sjogren syndrome present with are going to be dry eyes, dry mouth, and arthralgias. It's a little bit challenging because I feel like a lot of patients may not just overtly state these like issues with a neurologist or a headache specialist, maybe they might actually present to the ophthalmologist or optometrist with dry eyes. But if you do identify this in a patient and they report this to you, maybe go about screening further, with the other cardinal questions: dry eyes, dry mouth, arthralgias, and then screen for other rheumatological related questions such as possibly photosensitivity, any ulcers, any rashes, and then kind of narrow the differential that way. And then if you do have a high suspicion for Sjogren syndrome, then you can also test a rheumatological panel with other rheumatological conditions as well.
Awesome. Well, thank you so much for your work. We're really excited about this project and look forward to seeing more from you as you continue on your career.
Thank you so much.